Welcome everyone. Today we'll be discussing this topic, which is a disaster management. So, a disaster, uh, as by definition in itself, is something that is unavoidable, inevitable. It can happen all by accident. Uh, it can be natural. It can be man-made. So, by definition, if we see a disaster is something that we cannot afford to have uh, in the perspective of losses. Uh, to prevent these things, we have to manage, we have to make sure to manage these things so that uh, the disaster, the level of disaster, the effects of disaster can be minimized as much as possible. So coming to the objectives of this lecture, uh, we will be looking at the definition, like what is disaster, and the classification and types of disaster. We will discuss the management and its various phases. We will describe roles of nursing disaster management. Uh, I would like to add few points that in this, for example, aside from nursing, we'll see that what can be the role of general person and the hospital team to minimize the effects of uh, damages uh, from these people, from the affected ones, as as possible. So yes, coming to the objectives, enlist various organizations working for disaster management throughout the world and in Pakistan. So, like we said, the definition uh, by the criteria of United Nations, the definition of disaster can be a serious disruption of a functioning of a community or a society. So, like we said, it can be something that is unexpected. That's why we categorize it as a disaster. So, disaster involve widespread human material, economic, or environmental losses. So here, if we can see, we all can see that the widespread human material that can affect economy or environmental. So if something that is man-made, and for example, the COVID, which was a disaster, it was a big disaster. It was a worldwide disaster. So what happened that because of that, the economical growth, the overall environmental impact was so huge and immense that uh, till this date, it's really hard to recover from the damages, the losses that we had uh, over the period of like more, I guess more than 2 years. Yeah, we can say that. So, uh, coming to the definition, a disaster can be defined as the occurrence either nature or man-made, as we said, by natural way or man-made, that causes human suffering and create human needs that victims cannot alleviate without assistance. So, continuing to this, any disaster can interrupt essential services. That's for sure. Healthcare services. Of course, the for example, if any disaster hits, for example, it can be environmental, it can be some kind of tornado, uh, fast blowing winds, or storms, earthquakes, uh, floods. So these are the natural environmental disasters that can cause serious health issues. And of course, the man-made disasters, for example, uh, the major uh, what you could say the major impact was the COVID situation. Electricity. Uh, in the environmental factors, the electricity, water sources, garbage removal services, transportation and communication can only be affected. So yes, in the definition we have wrote that the interruption can seriously affect the health, social, and economical network of local communities and country. So if it's kind of a pandemic on local scale, it will definitely affect the local communities. And if the pandemic is on the global scale, if the disaster is on a global scale, then each and every person can get affected. So yes, this is the definition of it. So in that we can say the hazardous effects that comes with the disasters. For example, the phenomena that has the potential to cause disruption, as we mentioned. So the damages to the people and their environment is a hazard. It's definitely a hazard. Types of disaster. There can be two types, as we said, natural and man-made. So in the case of natural, it can be uh, like flood, cyclone, earthquakes, volcanic eruption, epidemic, and tsunamis. In the case of Pakistan, we can only uh, assume like floods, cyclones, earthquakes, epidemic, and in some cases on the upper regions of Punjab and other side skirt areas of northern areas, we can say the tsunami can affect as well, because tsunami cannot be just in the oceans. Sometimes, I mean, it's water. It can make the disaster like that. So, as man-made in the man-made disasters, for example, air crash, which is unfortunate, but sometimes it cannot be controlled. Sinking ships, that can be some kind of a mishap or disaster or an inconvenience. Train accidents, building collapses, bridge collapses, bomb blast, and warfare. So these are the man-made disasters that occur uh, mostly in our region, in our country. So coming to the natural disasters, tornadoes, volcanoes, tsunamis, dust storms, forest fire, thunderstorms, snowstorms, hurricane, hailstorm, flood, sandstorm, and sinkholes are uh, the natural disaster which which sometimes cannot be avoided. So coming to the next slide, uh, guidelines for disaster management. Okay, the main guidelines for disaster management is to prepare an action plan. What is action plan? For example, let's say if in case of a flooding in Punjab, usually it happens over there. So in the days of um, rainy days, let's say in the rainy days, the flooding, uh, or in the cases of monsoon, the flooding happens because of the mismanaged canal system or something that might be blocking the drainage systems or the spillways, etc. So this can happen. For that, we should have a proper action plan. For example, if in case that happens, we should have prepared, a medical team, a support team, an evacuation team, and teams like that. Disaster management in for the disaster management, the army plays a major importance, important role, major role. So people in that case can volunteer as well. So as we should have a proper action plan, allocation of adequate resources. We should have budget for that. We should have proper resources for that. We should have a stock for that. Uh, Technically, if we should be able to accommodate surplus people in case of any kind of disaster, we should have, some kind of assumption that we can or we may be able to, or the disaster management team or the disaster department will be able to manage, let's suppose, 1,000 people or 2,000 people or 10,000 people. This figure can rise, so they should have a backup plan as well. Implementation in surety is the priority. Responsibilities of different services. They should categorize the responsibilities to different people, different departments, different organizations. As mentioned, regulatory framework should be there. Code practices must also be present, like procedures and standards should be followed. Inspection, safety, auditing, and testing of the emergency plans should also be in the pipeline. For example, let's say if we have some kind of plan, some kind of implemented thing that we say, okay, we're gonna do this and we're gonna do that. So for that, they should be prepared, and in various cases, they should be checking, keeping an eye on these things, because it's important. If uh, these kinds of check and balance aren't there, I mean, disasters can happen and it can damage more and more. So inspection and emergency plan, testing of emergency plans is priority. So technical and technological information for the preparedness should also be there. They should have an early warning system as well. In case of early warning system and testing of the emergency plan, education and proper training is must. We should educate people that in case of any disaster, you should follow the protocol, the codes, so to avoid uh, maximum damages. Creation of disaster management authorities must. Capacity development of all teams. Awareness generation among people, that comes in the training as well. Education, that's the point, that's the word. Institutional framework should also be there. Information sharing must be on a high priority. Like for example, in case of disaster alert, in case of flooding, they should all have a or an early warning system. Medical teams should be on the go, on the ready. Research and development is important. Response, relief, and rehabilitation is the key, and the mock drill. Mock drill is the same as testing. In case of any disaster, people should be prepared. So, like we said, process of planning and organization and coordinating and implementing measures which are necessary, which are also part of the disaster management. Reduction of risk of any disaster or its severity is the main priority. These are the points that are also already discussed in the previous slide. So I'm just gonna move on to the next slide. Okay, trauma team. What is a trauma team? These are the people, like multidisciplinary group of individuals, like they are specialized in their own capacity. They know what to do and how to do it. So in case, for example, nursing staff or surgical staff or technical staff, they know what they have to do in case of emergency or in the regular situation. They should have uh, high experience and training that should make them immune to any kind of situation in which uh, we should make sure that they do not panic. So these are the specialized people which are called upon in case of any disaster. So you can call them a trauma team. What should be their roles and responsibilities? The primary aims of these teams is to stabilize the patient. That's the main priority. Contain the situation. That should be their main priority. Determine the nature and extent of the injuries in case of any disaster, uh, because saving lives is the main priority. Care and need for the injured people should be on the priority, which is always is. So preserve the severely damaged organs or limbs. In case of any unfortunate event, they should be prepared to save life, and, and they should be prepared to do anything uh, to save the person or and the, like masses life as much as they can. And yes, transport action plan should also be there. Transportation is must, because in case of any emergency, which is not basic and cannot be handled on site, they should have a transport service that may take people to the remote area or the facilitation that have the facilities to provide the services, the medical services they require. Like local, regional, and national international organizations are all involved in mounting a humanitarian response to disaster. Uh, each will have prepared disaster management plan. These plans cover prevention, preparedness, relief, and recovery. So these are the points: prevention, preparedness, relief, and recovery. So the next slide, which explains the phases of disaster. Like disaster prevention is must. Like we always say, prevention is better than cure. So prevention is on higher priority. One should be prepared for any bad situation, providing relief and recovery as soon as possible. So prevention is what? Provide a permanent protection. Not all disasters can be prevented, but we should make sure that we are doing as much as we can. So risk of loss of life and injury can be reduced with a good evacuation plan. As we say that prevention is better than cure. So yes, if evacuation plan is a strong plan, that in that case we can save as many lives as we or maybe more than that. Preparedness, we should always be prepared. Like something bad can happen anytime or at any instance. In the cases of, I mean, in the days of red alert or something, for example, removing people from property before the threat rises on their head should be like a priority. Relief, providing with relief, like providing food to people, providing medical resources to people, providing shelter to people, and providing different services so that their trauma can be reduced as well as their other losses. Recovery. It is the priority of people to act on the recovery plans as soon as the events hit on any place, like uh, infrastructure, healthcare, and rehabilitation system must be rebuilt in case of any disaster. And such building human resources for health and development policies, practices to avoid similar situation in future. So we learn from our mistakes. We must make sure to not repeat this mistake or any mistake if that has been uh, missed the last time. So we should make sure that doesn't happen again. Okay, the role of nursing and in disaster. In the case of nursing, it can be anything like medical teamwork, etc. Adoption of professional nursing skills is recognizing and meeting the physical health and emotional needs. So nursing goal should be to achieve the best possible level of health for the people and the community affected by the disaster. So this should be the priority, the goal. Uh, Roles of nursing in a disaster. Okay, prevention should be identify the community risk factors. Public education is must. Pre-vaccine program should be prepared and disaster planning must be done. Preparedness should be public education, disaster drills, trainings of nurses, know the emergency communication plan, evacuation plans, identify the support agencies and personnel. So to give us a general example, in any case, I'm sure uh, that many of us would not know how to give a certain person a CPR. So that's kind of like a thing. It's a weakness. But yes, medical people do know how to do that. So in that case, we should be trained for that. Like if in any case, if the medical team is unable to reach on time, a normal person or people in general should have the quality to provide such basic needs to other which are affected by that. Responses should be medical treatment for the injured, personal safety, and triage. Recovery should be evaluating the incident and identify area. So damage area should be defined. And long-term injured community health restoring in should be also be followed. Community preparedness, as I'm saying again and again, that education is must. First aid program education is must. They should know how to operate following things like battery operated radios, flashlights, first aid kits. They should have that. They should keep that. Supply of food and water for at least 3 days. Medical information, like basic medical information, should be there. Uh, any next of kin in case of any emergency should be there, which we usually avoid. I mean, we technically we don't have any kind of next of kin situation in most cases, which should be followed. It should be changed with because in a bigger picture, it's actually our own safety. Okay, in Pakistan, there are different organizations working. For example, UN organizations are there, PCSIR, PRCS is there, IRC is there. So there are different organizations, international organizations, plus NGOs, local NGOs that are working on different plans on different scales and in different sectors. So all of these are controlled through National Disaster Management Authority, NDMA, which is a government organization, which is actually responsible to manage all that uh, and to guide other organizations to go and uh, provide relief to other people. They have their mission and vision, which you can read through these slides. So like we say, 13th of October is basically an International Disaster Reduction Day. On this day, uh, the people usually pledge that we would provide a better healthcare system as much as they can, as much as we can provide to other people, because every life matters. It's not just about people, it's not just about human being, it's about every living being. Like if we do good uh, with some animal, in return we shall be paid with the good deeds, or we shall be paid with the in some other way. So we should always look forward to help others in any disaster, in any case, not just in cases of, like, in pandemic or in any natural disaster, but in general as well. We should have the sympathy to do that in our daily life, uh, and in routine. So this was the topic of today. Thank you so much for being with me, and inshallah, I'll see you in next lecture. Thank you.